All right, this video is going to just be more of a discussion on what I'm looking for during the discussion forum this week. So we are in chapter 4 of our textbook. And so in your primary initial post that's due by Wednesday, you have 2 questions to answer. Number 1, how difficult is it to treat clients with mental disorders or disabilities? So if somebody has a co-occurring substance use and mental health diagnosis or substance use and disability, how is it difficult? How difficult is it and why? Number 2, as you consider your own work as an LAC, are you drawn to an integrated or a sequential treatment approach? And explain why. And in your explanation, what are the benefits and drawbacks to this approach? Remember that when you are writing your initial post and your response post, it's helpful if you put it in this format of question number 1 and answer it, question number 2 and answer it, and incorporate course materials into both your primary post and your response post. So be sure to incorporate course materials and cite them. So let's look at our response post. So you need to respond to a minimum of 2 of your classmates, and you've got 3 things to reply to. What considerations for treating a patient with mental disorders or disabilities were missing from your classmates' posts? So there are so many considerations. It's okay that we miss some. But what we can do for each other is to help identify some of those blind spots or some of those things that we're not thinking of. So that's what you're doing, is you're helping the original poster or your classmate in their primary post say, yeah, yes, and don't forget about all of these other things as well. So what considerations did your classmate identify that you missed? So question number 1 is different. Question number 1 is, hey, I identified these, but you in your original post didn't mention them. And then number 2 is the inverse of that. So what did my classmate identify in their primary post that I didn't identify in my primary post? And then number 3, how does this influence your opinion of working within a treatment team? Is it important to work with other providers? Explain. So really, in questions 1 and 2, we're looking at, hey, you missed this and I thought of this, and I missed this, but you thought of it. So as we look at what our blind spots are, those things that we're not considering and thinking of. So think about that as you answer number 3. As always, you're going to be unable to see other posts until you submit your initial post. So remember that usually takes about 15 minutes to update in Moodle. Due dates: Wednesday, the 28th for primary posts, Friday, the 30th for response posts. And then, as always, our notes on confidentiality and a link to the forum grading criteria if you have questions about that. So I'm really looking forward to seeing how you engage in this and to support each other in this dialogue where we're looking at these really complex issues. So thanks everybody for watching. As always, please head on over to the homepage and use that forum if you have questions. Thanks everyone.